Skin pinch for the lower lids, crepey lower lids. It wrinkles when I smile. I don't like it. I pull on it. I do this and tell my doctor that this is all he needs to do. Why can't he do that? It should be really quick. Yada, yada, yada. What is a skin pinch? Skin pinch is, this is like partway through a skin pinch. We still need to smooth it out a bit, but we're literally pinching up the lower eyelid skin, the excess lower eyelid skin, without pinching the muscle up with it. You do not want to cut that muscle out. If you have an annoying jelly roll when you smile and you don't like it, get some Botox for it. Do not cut that muscle out, because that muscle is what supports the lower eyelid. If that muscle gets damaged, if you get a stroke or a Bell's palsy and that nerve that supplies that muscle gets damaged, your lower lid pulls down. Not because the tendon got weak, but because that muscle no longer works and it doesn't support the lower eyelid. We do not want to cut this muscle out for funsies, ever. So skin pinch allows us to safely do that. What's nice about it in theory is that when you pinch up the skin, you should be able to tell that it is not changing the lower eyelid position at all when you do it. So it should be easier to gauge that you're removing the right amount of tissue. But in some cases, instead of doing a skin pinch technique, we do a skin flap technique, which extends like this, and you're actually dissecting the skin. It takes a little longer, but you can potentially remove some more skin doing it that way. Just more chance of like disrupting muscle. It's a little more difficult dissection, but in a lot of cases it's worth it. Just depends on the patient. If you have crepey under eyelid skin, that does not mean that you're a candidate for a skin pinch, because a skin pinch does not treat skin quality, it treats skin quantity. And most of the time, the lower eyelid skin is a skin quality issue, not a quantity issue. If you want the most bang for your buck combination of things to improve the quality of skin under your lower lids, the quality, quantity, the look, everything about it, it's a combination of treating the excess, if there is any, via skin pinch, skin flap, whatever you want to call it. It is treating the skin quality with lasers. You can use pico lasers and pulse dye lasers for pigmentation. You can use laser resurfacing to also tighten the skin if you are the right skin type for it. And so for a lot of patients, I will just say, let's just do a deep laser resurfacing. That's all you need. We don't need to cut any on the skin on the outside. So laser resurfacing will do that. Pigment targeting laser can target some pigment. And then nanofat stem cells. When we do our fat grafting, we inject nanofat stem cells. Most powerful thing you can do. You can do at-home treatments to thicken up the skin. You can do PRF and some of these exosome products out there, which I'm not sure if they're all really work or not, but in general, those growth factors. So that combination. And then, of course, remove the little eye bags if you have them.